More than 1 million people live in the 310-mile-long border region of Ireland. In both jurisdictions, they share common challenges, including rurality, infrastructural deficits, pockets of high poverty and distance from urban centres, and regional services. Before 1992, when CAWT was established, there had been little or no cooperation between health and wellbeing authorities, north and south. CAWT, which means cooperation and working together, was set up to enable the health and social care services from both jurisdictions to collaborate in the interests of benefiting citizens living in border regions. CAWT also facilitates all-island emergency planning and north-south health and social care cooperation, supporting cross-border initiatives in coronary and cancer care in both jurisdictions. Since CAWT began its work, the scale and impact of cross-border activity, largely funded by EU structural funds, has mushroomed across children's services, disability, mental health and well-being, physical health and well-being, ageing well, and community resilience. This has enabled the partnership to add value to statutory services and share best practice among the partner organisations, ultimately leading to improved quality and access to patient services. The partners in CAWT are the Health Service Executive in the Republic of Ireland, along with Northern Ireland partners, the Southern and the Western Health and Social Care Trusts, the Strategic Planning and Performance Group, and the Public Health Agency. CAWT projects have resulted in an investment of more than €70 million in health and social care in the border region, helped more than 100,000 people, provided more than 45,000 training interventions, and created more than 300 jobs. Throughout the 30 years CAWT has been helping to improve the lives of people living in the border region, there have been many challenges, politically, economically and socially, as well as the global COVID pandemic. CAWT partners continue to confront the challenge of recovery from the legacy of COVID-19. The cross-border healthcare sector had already faced enormous pressures prior to the pandemic, particularly around human and financial resources. So significant work is ongoing to rebuild the sector and strengthen future resilience in line with good practice. Staff within the CAWT Development Centre continue to support partner organisations across government, academia, private industry, the voluntary and community sector and statutory agencies by exploring new initiatives and engaging with potential collaborators to co-create cross-border projects which can be advanced through its partnership structures. Cross-border cooperation will continue to underpin all of CAWT's health and social care activity, which is driven by the needs of the region and the health priorities of all of the key partners. Fundamentally, CAWT is about people, helping those within the border region to gain access to services, reducing health inequalities, and through strong institutional cooperation, making life better for local communities. CAWT has come a long way and has made a real difference to people's lives in the past 3 decades. This work continues with a commitment to keep serving the health and social care needs of those who live in the border region.